All right, here we are, 1 week away from my aortic valve replacement surgery. Yesterday, so this is actually 6 days away. Yesterday, I spent a kind of marathon day at the hospital with um, CT scans and meeting with PAs and nurses to go over consent and also doing all the pre-admission testing as well as just kind of getting some other information about the hospital and what's going to be going on. So ended up being about 8 hours total there in the hospital, just from appointment to appointment with time in between and grabbing lunch and that kind of thing. So just what to expect, at least from my end, what I did. So arrived yesterday morning and started off with a CT scan that was ordered by my surgeon, so that way they can get proper measurements on the root just to see if there's any other aneurysms, anything else to prepare for. Also checked so that the scan was basically from neck down through the torso, pelvis, and everything. So that way they can check, the artery fully, all the veins, just to see if there's any kind of blockages or stenosis or aneurysms anywhere throughout the whole system as we're doing the surgery prep and coming up with a plan for next week. And so did that to start with. That took about half an hour, give or take, once I got back and went through all the process of getting set up. So um, pretty simple. If you've gone through a CT scan before, it was just a little bit longer than normal, I guess, because it was a little bit more full and detailed look. Um, I did see the results for that, so everything came back great. I was kind of joking around. If it wasn't for this the bad valve, I'd be in pretty good shape because there's no aneurysm. There's only dilation of the root, as well as the bicuspid and the regurgitation in the valve. But all veins, all arteries, everywhere else, there's no aneurysm, there's no stenosis signs, there's no blockages, nothing like that. So very happy with that. Happy that uh, I've taken pretty good care of myself and exercised, and even though I haven't eaten all that well, I think the exercise has balanced that out. So that's always a good thing for me. After the CT scan was done, it was time to move over and move up to a different office in the hospital, the actual heart valve center, where the surgeon's office is. And so went in and met with the nurse and one of the surgeon's PAs. And that was really just to go over the final consent and just ask any other questions. I say final consent, I guess there'll be more consent on Friday morning before the surgery. But to go over consent, confirm that I wanted the Onyx mechanical valve, go over the risks that are associated with the surgery, and like I said, ask any questions. So that was a pretty brief conversation. Again, thankfully, I'm 39 years old. I'm in good shape, and so the risks are quite low. Less than 2% is really what was communicated to me. Um, but going through and just talking about how the closure is going to be, because I was curious if it was going to be the rigid plate closure or the wire. And my surgeon does prefer the stainless steel wire to close the sternum, which I'm completely okay with. I was just curious going in, and then just going through and checking those things off, asking a couple of questions about recovery. She did say that their plan and their goal is to have me home from the hospital 4 days after surgery. So, going on Friday, hopefully, if all goes according to plan, be home on Tuesday. And again, that her confidence level was quite high that I would, after a couple of days, I would, start showing some improvements. Obviously, I know there's a long road when any kind of trauma of that nature goes on to your body, but it was a good appointment, answered some questions like that, and continued to give me that confidence that A, I chose the right surgeon and hospital, but B, that this will be a, a routine thing for them, and they see this type of thing all the time. So that was the nurse visit, the PA visit, and then from there we moved over into another part of the hospital for the pre-admission testing. This was the longest part of the day, and that's where we went in and just confirmed for the 600th time my name, birth date, all those kind of things, which I understand, but it was funny going through yesterday. And that was basically as soon as I met someone or moved into a different office, that was the first thing I had to do is confirm everything. So went through, did a few things of paperwork there on the front end, made sure insurance was all right, and then moved back into the admission nurse's office. And from there, just ran a full gamut of tests. So um, lots of family history, surgical history, all those questions, health history. So it was just answering questions left and right for a few minutes there. I did an EKG. Um, so again, pretty simple. Just throw the stickers on me and sit there for a little bit. Blood pressure test, pulse test, all that kind of good stuff. Then from there, we did blood samples. So I think they took maybe 7 or 8 vials of blood. Small bottles for different testing, and got all those results back. And I think there's 7 or 8 different panels and tests and things they ran on my blood. And again, just as I saw those results come back yesterday, I only had 2 things that were flagged, or maybe 3 things, and all of them were such a very small thing that was out of whack. Was very encouraging again to know going in that I am in good health, so that this recovery will be better and easier. It should be. And so I only had a couple little things out of whack, but again, I don't think I've ever been tested. My blood's been tested for as many things ever in my life. So um, that was that was a little bit of a time, but not too bad. And then from that, I got to put on this nice red hospital bracelet that I was told that I get to keep on for the week and not to take off before I come in next week. So um, that'll be fun to walk around with that for a week, but I'm already pretty much used to it. After that, the nurse went over a few other things. She gave me the Hibiclins that I'll be using, this week pre-surgery, as I shower, just to help, cut down on, bacteria and all the other stuff going in on my skin. Also the spirometer here, so I can go ahead and start using this for my breathing exercises. From everything I've seen and watched and heard, it's going to be such a big tool for recovery to get my lungs back up and working. So I already messed with it a little bit yesterday, and I can, even in good health, exercise, all that stuff. Uh, Doing this yesterday showed me like this will probably be tough. So I'm kind of looking forward to it, but I'm a competitive person, so I'm ready to start moving the needle and keeping up with that on the spirometer there. So got that, um, as well as she went over. I have a couple of medications that I'll be taking this week leading into the surgery. One is the ointment that goes inside the nose for a couple of days leading up to the surgery, and another is a tablet that I'll be taking, as well as stopping one of my current medications a couple days before the surgery. So went and picked all that up on the way home. Have all that here, and then just a list of things to make sure I have this, that, and the other in place. Then wrapped up with her, went over to another area and had a couple chest X-rays. That took all of 30 seconds to go in and get 2 front shots and 1 side shot, and then we were off. My wife and I went and grabbed lunch across the street, and then walked around a little bit in the heart tower, which is where the operating rooms are, the ICU is, and also my step down recovery room will be. So walked around there and then spent some time talking to one of the patient reps, as more of what to expect. I'll tell you from my experience, that was a good conversation, but I kind of know what to expect. And I've been kind of pointing out to people, this is all going to be happening to me. So as things happen, it'll happen. But for my wife and anybody that wants to visit, there's more of a plan that needs to happen. So that was a great conversation for her. Down to, he gave us a few tips for checking in to be there early, so I will be there. My appointment says to check in at 5:30 a.m. on Friday, and he said, hey, go ahead and be at 5, because with a cardiac case, they like to get those cases back very, very first. And since I am the first case of the day, he said if you get in at 5, you may be able to get back, before 5:30 instead of checking in at 5:30, and that'll just give you more time pre-op to go through everything with my wife there before she has to move out. So that was good. He also explained kind of the process of where I'll be moving, the visitor policy, um, what to bring, what to expect as for the family while they're there, and all of that stuff. So again, I would highly recommend, if you're going through this, and I'm sure your hospital has this, patient rep or patient navigator or something like that, to get in touch with them and talk through the kind of ins and outs and what's going on. This gentleman was a former nurse and actually worked with a lot of valve patients before, so and has worked with my surgeon before, so he got to explain a lot of what he likes to do and that kind of thing. So I think the big thing that, at least at this hospital, that my wife took away is once we get signed in on Friday and she comes back with me in pre-op, she leaves, and then from that point on, that she has one patient representative assigned to her, and they will be communicating every step of the way with her, you know, phone, text message, or in person if she's close by and they can see her in the waiting room. But this hospital is quite big. There's some outdoor areas and some other areas. So any different step that goes in where they're putting me under, they're opening me up, the surgeon's coming in, all those things. I'm going on bypass will be communicated to her, and I think that's a pretty standard thing. But again, it was nice and calming for her to hear that. And then once the surgery is done and the surgeon is wrapped up, there are separate private consulting rooms in this hospital, and so the surgeon will meet with my wife and whoever else is there family wise, to go over how the surgery went and that kind of thing. And then she'll be able to come up and visit me in the CVICU, and it sounds like everything I've seen, everything I've read, and what they were telling me is, I'll wake up here and there, but that day will be pretty groggy for me. However, we'll get to that point next week when we get there. So that was basically the end of the marathon day at the hospital, going through pre-admission and testing and all that. And again, thankfully, it shows that it looks like it will just be the valve that needs to be replaced. It doesn't like there's any issues with the ascending aorta, the coronaries. Everything else seems clear, so there's none of that. Obviously, when they get in, they can do some exploring just to make sure. But I'm very thankful that this will be kind of in and out, as you can say, as much as you can for the for a valve replacement. So that's kind of the end of what to expect maybe there, at least from my experience. From here, in 2 days on Monday, I'll be meeting with my family doctor, general practitioner, however you want to call that, just to go over current stuff, to explain to him what's going on, so that way he's aware, because he's here in town and will be treating me for everything else along the way, just to keep him in the loop. So I'll probably make a video after that on Monday. And then if anything else interesting happens as I'm using some of these tools or medications or anything, I'll make a little video through the week. And then we'll be ready in a little less than 6 days to head into the hospital for the actual procedure. So that's it. 1 week out. Pre-admission testing, CAT scans, consent forms, patient, representatives, and all that goes into that. I would say overall it was an exhausting day, but a great day, a lot of good information. And, at this point I'm kind of excited and ready to get this going. I feel really good about everything, and look forward to learning a few more things along the way, but then get this done here in a week and talk to you on the recovery side. All right.